Picture this. It's 2 in the morning. You've got this terrible, hacking cough that's been keeping you awake for hours. You finally drag yourself out of bed, throw on a coat, and head down to the only 24-hour pharmacy in your neighborhood. You're fully expecting to just grab your usual, reliable cough remedy right off the shelf, exactly like you've done a dozen times before. But tonight, the pharmacist shakes their head and turns you away. Welcome to This Explainer. Today we're unpacking a massive shift in how we buy everyday medicines, focusing squarely on a brand new government restriction that is totally changing the landscape of local pharmacies.
So, I've got to ask you directly, why is your favorite cough syrup suddenly locked away? You walk in, cash in hand, but the medicine is sitting firmly behind the glass, totally inaccessible. And here's the thing, it's not a supply chain issue, it's not a stock shortage, it's a fundamental change in the rules of the game. So let's figure out together why medicines we used to buy without a second thought are suddenly wrapped up in all this regulatory red tape.
Section 1. The new pharmacy rules.
Okay, let's dive into this by establishing a quick baseline. We're talking about OTC, or over-the-counter medicines. By definition, these are medicines sold directly to a consumer without any requirement for a prescription from a healthcare professional. Now, we've all relied on the sheer convenience of OTC drugs, right? In fact, the modern OTC system accounts for billions in sales globally and has been a total cornerstone of consumer healthcare for nearly a century. You feel a tickle in your throat or a sudden ache, you walk into a store and boom, you get immediate relief. It's this deeply entrenched system built entirely on consumer trust and rapid, easy access.
But, that trust is kind of being reevaluated right now. The crucial point here is that the central government has officially intervened. They've stepped right in to disrupt this standard over-the-counter access by specifically barring the sale of certain items. And when the center makes a move like this, it isn't just a minor administrative tweak. Actually, it's a sweeping mandate meant to alter consumer behavior nationwide. But why?
Section 2. Why target alcohol content?
The government didn't just pick these medicines at random. And this brilliantly illustrates the core problem they're trying to solve. We have to look at the stark contrast between intended use and misuse. On one hand, you have the intended use of these medicines, which is, obviously, treating ailments and providing genuine medical relief for sick people. But on the other hand, you have the misuse, recreational consumption and intoxication. Because these specific formulas contain alcohol, which is often just used as a solvent to keep the medical ingredients mixed together, they became an incredibly easy target for exploitation. To put that into perspective, some of these everyday cough remedies pack up to 9% alcohol by volume. That's actually more than your standard beer. People weren't just buying them to cure a cough, they were buying them for a cheap, easily accessible buzz, entirely bypassing liquor laws and safety standards.
And here's the exact phrase that triggered this whole crackdown: drugs with high alcohol content. It was that specific wording that completely changed the game. Regulators observed that this high alcohol volume essentially turned helpful medicines into potential intoxicants. So, to combat widespread abuse, they had to surgically target the alcohol content itself.
Section 3. What the mandate says.
So how exactly is the government closing this dangerous loophole? Well, let's look at the everyday medicines that are now caught in this new regulatory net. We're talking about highly common items here. Cough syrups are for sure the most famous example, particularly those well-known codeine-based syrups that have literally been medicine cabinet staples for decades. But it doesn't stop there. It also includes various general health tonics and a really wide array of liquid formulations that rely on high alcohol content. Basically, if a liquid medicine in your cabinet has a high alcohol percentage, it falls right under this new umbrella. We're not talking about rare, highly specialized drugs. We're talking about familiar household staples.
Now, what's really interesting about this is the massive operational shift happening. Under the old rule, your status was simply a shopper. The requirement, walk in and buy directly over the counter. Simple, fast, efficient. But under the new rule, the requirement is entirely different. A doctor's prescription is strictly mandated. You can't just ask the pharmacist for it anymore. You can't just pull it off the shelf. Without a piece of paper signed by a licensed medical professional, the whole shebang stays locked away.
Section 4. Impact on everyday consumers.
Because ultimately, policies on paper mean real-world changes for your actual routine. Let's walk through this new, expanded process you've got to navigate now just to get relief for something as simple as a severe chest cold. Step 1, you experience symptoms. Step 2, you schedule a doctor visit. But then, Step 3, you have to wait for and actually attend that appointment just to obtain the official prescription. Only then do you finally reach Step 4, purchasing the medicine at the pharmacy. What used to be a single-step, 15-minute errand has now evolved into this multi-step ordeal that introduces some significant friction. It requires your time, your copay, and potentially days of waiting just to see a physician.
Summarizing all of this, the reality of the mandate is pretty simple, and we just have to view it objectively. The era of easy access to high-alcohol remedies is officially over. The barrier to entry for these specific drugs has permanently changed. By prioritizing public health and curbing substance abuse, the government has basically traded away the ultimate convenience we used to enjoy. The medicines, they still exist, they're perfectly legal, but they are definitively gatekept.
So as we wrap up this explainer today, I want to leave you with something to really ponder. We've seen just how quickly a household staple can go from an over-the-counter convenience to a tightly controlled, prescription-only drug, all because of the potential for misuse. With alcohol now heavily restricted in these formulas, what everyday OTC ingredient is next? As regulators keep a close eye on how consumers use and misuse accessible remedies, what other common items in your medicine cabinet might soon be locked away behind a prescription pad? Definitely something to think about next time you're browsing the pharmacy aisles. Thanks so much for learning with me today.